story is the government facing a serious backlash after announcing that COVID jabs are now going to be compulsory for frontline NHS staff in England from April next year.
Around 100,000 workers who are currently unvaccinated face losing their jobs unless they get both doses.
Health Secretary Sajid Javid joins us now from Glasgow. Good morning. It is good to see you this morning, Mr. Javid. What are we going to do when we lose 100,000 NHS workers?
Can I just also say how refreshing it was to hear from Frank Bruno just now, talking so openly about mental health, and as you said and he said, there is absolutely no shame in mental health challenges, and I just want to urge people to come forward as he did, or if they themselves or loved ones. I just hope you don't mind me saying that. I just think it's so important to reach out with people that might have such challenges. On your particular question, actually, let me just start by thanking the many thousands, hundreds of thousands in the NHS, in social care, that have already taken the vaccine. And the reason that they've taken the COVID-19 vaccine is not just to protect themselves or to protect their colleagues, but most of all to protect their patients, because they know that their patients are some of the most vulnerable people in our society. That's why they're in hospital or care in the first place. And I think it is our duty to do everything we can to protect them. Now, no one wants to lose anyone in the NHS. They're all doing fantastic work, whether they're vaccinated or not. They're doing amazing work. And what this is about patient safety, and it is about working with those that, for whatever reason, at this point in time, have chosen to remain unvaccinated. It is about reaching out to them, working positively, and helping them with the support that they might need to make a positive decision.
We already have a shortage. For instance, we're 40,000 nurses short in the NHS. We cannot afford to lose that many NHS workers come spring next year. Why can we not keep those workers but provide a contingency plan? Right. They already wear PPE, institute a mandatory testing programme, for instance. We're being cavalier with our staff at a time when we just cannot afford to be.
No, I don't want to see anyone walk away from the NHS because of this, and the measures that you mentioned, other than vaccines, such as PPE in the appropriate places, regular testing, that's already being done, and that's not going to change. This is about doing everything we can, and what we do know about vaccines is that they work. They don't just protect you, they protect others. They massively reduce your chance of infection. If you are not infected, you cannot infect others, and that's what this is about. Because if people, let's say, whether it's the NHS or care, let's say if thousands remained unvaccinated, what we will have then is a situation with people that are more likely than otherwise to be infected, perhaps asymptomatically, and they could be going from ward to ward, to patient, infecting very vulnerable people for whom it could be fatal to come into contact with this virus. And that is not something anyone wants to see. And this is, again, about making the right decision to protect people, carrying out our duty to do everything that we can.
Okay, so I'll go back to my first question, which is, what are we going to do about it? You're insistent there are going to be no alternatives. 100,000 NHS England workers have to be jabbed by April or they lose their job. What are we going to do in the gap?
Where you can get the staff from?
The first thing we're going to do is trying to make sure. Well, actually, if I may just answer that, the first thing we will do is to make sure it's not 100,000. 100,000 is the number today. If we look at the evidence where this has been done elsewhere, so if I look at France, they did something, actually, they did the same thing back in July. They announced it earlier than us for their health system. At that point in time, 60% were vaccinated. Now it's 99%. We've done something similar. You'll know, I think I've discussed it on your programme before, for care home workers. That was done earlier, and that actually the enforcement of that.
Sorry, Health Secretary, sorry, just one second. You've extended the time for NHS workers to go and get vaccinated, right? They've got till April. Today, this is the deadline for care workers. And part of the reason you've extended time is because you've practically looked at it and you don't want to lose workers. Why can't you extend that period of time for care workers as well, to get more of them on board so we don't face the care crisis that millions of people are facing today?
Well, if I may just to correct that a bit, is that for care workers, for care home workers, we haven't extended the time. The difference is that that was announced 3 months ago. So care workers were rightly given the period of time that was necessary, about 3 months, to go and make that positive decision and to get vaccinated. And that is why for care home workers, the enforcement kicks in tomorrow on the 11th of November. For NHS workers and for those in other social care settings, such as, say, domiciliary care workers, that announcement was only made yesterday. But just as we did with care home workers, there's a period of weeks after the legislation goes through Parliament to allow them to make that positive decision and to get vaccinated. And that is why the NHS decision kicks in on the 1st of April, because I think it is right that we work with people positively. And let me also be really clear, there is no room for any kind of scapegoating, singling out or shaming of anyone. Look, anyone who's working in the NHS or care, they're doing a fantastic job, whether, as I say, whether they're vaccinated or not. This is about reaching out to them positively, supporting them in every way.
So they're about to not have a job today. Now, we need to move on. Can I just ask you a quick hypothetical, if I may, Mr. Javid?
Sure.
Imagine you're no longer a health secretary in, let's say, I don't know, a year's time, a month's time, who knows, it's politics. Would you take a job in the British Virgin Islands, just pause, take a job in the British Virgin Islands, advising their government on the vaccine rollout, move to the British Virgin Islands instead of doing your constituency work and appear to be in your constituency? What would you say about a person that did that?
Well, I don't think that's quite a hypothetical, but I don't want to get into any one particular individual,
well, I've got one,
an
Geoffrey
MP,
Cox.
whoever he or she is, but I thought you might have one, but I will answer that question more generally, because I don't want to get into an individual case, by the way, because I just don't know the details of every individual. But of course, we know MPs, they can have external interests, and I've had them myself when I was a backbench MP. But I think it's important, just as I did and others do, that to be very open and transparent about that, and to make sure you're following all the rules. Of course, no lobbying under any circumstances, and whether they've made the right decision or not, as long as they're totally transparent, that is ultimately a judgment for their constituents to make.
Before you became Health Secretary, you did have a role, while you were an MP, advising JP Morgan. One of the criticisms of Sir Geoffrey Cox is that he broke the rules using his parliamentary office for his second job, part of which is to advise, as Rob says, the British Virgin Islands government. You've said this morning you may have used your office for your job. You were asked whether you did virtual meetings from your Commons office. You said, I had phone calls. I might have received a phone call. Do you use your Commons office for that external work?
No, look, I think, so just be very clear on this. As a general rule, no MP should be using anything that's been funded by the taxpayer, whether that's their office or anything else, for their personal gain. Of course, the MP shouldn't be doing that. If you're asking, can you be in your Commons office or walking in the corridors of Parliament and your phone rings and it's the person on the other side is talking to you about something that's got nothing to do with your parliamentary affairs, then of course that can happen, and of course you might take a phone call. But the general question that I'm asked, and I think hopefully I think that's what you're referring to, is that should MPs be generally using anything that's funded by the taxpayer? Should ministers, for that matter, anyone, be using anything for anything other than the appropriate business?
Well, there's a rule against ministers doing it, of course. MPs, backbench MPs, are allowed to have these second jobs, but the rules are that you can't use your parliamentary office in order to conduct that business.
Yeah,
so,
and that's right. I think that MPs, as a general rule, of course, you should, whether it's anything that's funded by the taxpayer, is there to benefit the public and not anything else.
Mm-hmm. Sorry, Susanna asked you a question, and there was a lot of language in there, and I didn't understand it. So who knows? There may be the odd person at home that also doesn't. Did you or didn't you get a call from JP Morgan? Yes or no? I mean, and have you done anything? Have you done anything that would contravene the parliamentary standards? Yes or no?
No, I have not done anything that would contravene any rules or standards.
Can I ask you what you think it does to, the public's view of politicians when we look at what Geoffrey Cox is alleged to have done? Presumably that's not the behaviour that you would hope for from any of your parliamentary colleagues, and it doesn't do much for the public confidence in the Conservative Party, right?
Well, look, again, you're trying to draw me into a particular case, and I'm not going to go there. I don't know the details. And you're also trying to make this an issue about the Conservative Party, and you will know that many members of Parliament, including, for example, the leader of the Liberal Democrats, many Labour MPs, that have external interests. As far as I know, they've all declared those interests, as they should. And as long as they are following the rules, that is, right now, is the most important thing. Is there a case that rules should be reviewed, looked at? I think rules should be constantly kept under review. But the ultimate test, I think, for any MP, again, as long as they are following all the rules and they are being open and transparent, is with their constituents, because that's who they ultimately need to justify everything they do, including anything external they might do, and let their constituents be the judge.
All right, Sajid Javid, thanks very much indeed for your time this morning.